The question is very interesting because teaching and practicing both are equally important for me, because I was working in an Ayurveda college where both are equally important. Was my job was to teach the students how to treat, then how can it be differentiated? Because after some years of my career, that means I was joining in Ayurveda college as a teacher in 1982, just after completing my PG in this eye disease specialization, immediately after my completion. Then from that day onwards, my responsibility was to teach students how to treat eye diseases. So, from the very beginning I came to know that if the practice should be continued, there should be some followers, and they will come, or they should come from the academy. Otherwise, there is no existence of that particular branch or particular science or particular subject. So, everything, all the doctors who are practicing in the field, they are coming from the academy. So, there should be somebody to teach them how to treat. So, both are same, both are same. I have even told the patients that I am here to teach these students how to treat you. So, you cannot give me any restrictions, only if you are ready to take all the risk, because these students will come to you and do whatever I am asking them, and you have to permit them. So, that is a very interesting field. Just to treat a patient is very easy, just to teach a student, that also is very easy, but how to follow it, how to practice it in the future, that is very difficult, and that is really a risky factor. If I have asked the students that you need not study too much in the classroom, you have to study from the patients, then I will take them always with me to the patients. And suppose a student is sleeping in the room, I will stop my class. So, that is my failure, because at that time that I am not a teacher. In the classroom, if a teacher is a teacher, a student will not sleep. That is my concern. So, I will take them outside and make them or I will ask them to dance or sometimes to sing, like that, and they will be interested, they will listen to me. And sometimes what happens, the patients also will be interesting to see these students, because they will be interacting them in such a way. And during examination also I have seen, sometimes the students will say, oh, I could not write the answer, I could not understand, because the patient did not say what is his complaints. Then also the blame goes to the students. I will ask them, why the patient is not telling you the truth, because he could not, that patient could not believe that you are a doctor, that is the reason. But these all responsibilities come to the teacher. If a patient is not obeying a doctor, the responsibility is not to the student or not to the patient, it is to the teacher, because he is in responsibility that a patient should narrate, should say all the details, personal and this disease wise, to the doctor. This is the training. So, that is a very interesting field, to teach a student how to treat. Then how can I differentiate both, which is better, which is worse, like that we cannot say, both are equally important. And in Ayurveda there is a saying, there are 4 pillars in the field of treatment. One is doctor, one is a therapist, one is the drugs, and other is the procedures, like that. So, I have added one more. In an academy, in Ayurveda colleges, there are 5 pillars. The 5th one is students. Without student, there is no existence for any science, because they have to come out from the academy, and then it is their field, not ours. And also a student has to start from the point where a teacher has stopped, not to start from the beginning. That is the success of a teacher. If that person is again starting from the base and studying what the teacher has taught them, that is not a precious thing. If that student is ready or capable of starting his career from the point where the teacher has stopped, that much they have already finished, that is a saturated level. For that level I was trying always. Even now my students are calling me even now, not for asking questions or anything, just to it's a normal way. That is the success of a teacher. I am the first person in Kerala to get the best teacher award, maybe because of these things. Actually students are afraid of me and they love me too much, that I know. And even the doctors will call me teacher. They do not know, many of the even patients are calling me teacher, because they will say, when I talk to you, I think you are a teacher. That is my approach. Both are equally important for a person a doctor coming from academy, because any doctor comes from the academy only. That is the viewpoint, my viewpoint.